some people will have cognitive and psychological effects, almost like PTSD, after an episode like that. And I'm sure it will influence his own personal thinking.
You must stay at home.
Boris Johnson has revealed in a dramatic series of interviews in The Sun that doctors were preparing to announce his death from COVID-19 because he was so sick with the virus. So, of course, that does show that things were far more serious in terms of the Prime Minister's health than we were led to believe at the time, which has got us thinking, will this impact how Boris Johnson removes the lockdown? Maybe in a more conservative manner as we head into phase 2. Let me bring in Dr Hilary Jones. Hilary, what did you make of this interview? And do you think that Boris Johnson's brush with death is going to impact the policy-making decisions from now on?
Yeah, hello, Dan. It is obvious that you don't get as far as critical care and intensive care unless you're very sick indeed. And clearly, the Prime Minister was at the time. They, I think, considered ventilating him, but he managed to survive without the need for ventilation, which is a major step. And clearly he was very sick indeed. And I think that it's very few people can go through an experience like that and not to be very much influenced by it, not to be touched by it to a degree whereby you certainly take it seriously. Some people will have cognitive and psychological effects, almost like PTSD, after an episode like that. And I'm sure it will influence his own personal thinking. But I imagine that the decisions that are made about easing lockdown will be made in Cabinet or through COBRA meetings with scientific advice from several inputs. So I don't think it'll be just him making the decisions. I think he'll look at it in a measured way, but he will be only too aware from a personal experience that this is a very nasty virus, a very lethal virus for a proportion of the population. And I'm sure he will be very cautious in putting people's health before economics, but in a balanced way that is as reasonable as it can possibly be.
Now, Dr. Hilary, lots of talk in the news today that there could be hope about a reliable antibody test. So I'll get you to address that during our first question from Leslie Giddy. And Leslie asks, do you know how long antibodies for COVID-19 last in the body, and how close are we to an antibody test for the general population? Well, there's hope for Leslie now, isn't there, Dr. Hills?
There really is. And this is the kind of one of the holy grails we've been looking for throughout this pandemic. We've wanted to know to what extent people are immune after they've suffered from COVID-19 and how long that immunity lasts. Now, we don't know the answer to the second question because the virus has only been around for 4 months. So we won't know for some months to go how long immunity lasts, but we're much nearer to finding a reliable antibody test. It's been known for some time that there have been antibody tests around, but they just haven't been reliable enough. Only 70%, some of them, have been reliable enough, and that just isn't good enough because it would give a lot of people the idea that they're immune when they're not, that when they haven't had the virus. And for other people, it would tell them that they haven't had the virus when they have. So an unreliable test is worse than no test at all because it can be dangerous in that situation. We now have maybe 2 weeks away from Roche Diagnostics, a test which is 100% sensitive and 99.8% specific. In other words, it won't give false negatives and it won't give hardly any false positives, which is exactly what we want. It's reliable, it's accurate. And another test being brought forward in Edinburgh, doing the same thing, is just as reliable. And NHS tests will be able to carry these antibody tests out on a blood sample and tell much more accurately whether someone's had the virus and has immunity. And then when we do serial tests, we'll be able to find out how long that immunity lasts. So there is good hope for optimism that in just a few weeks we will have many, many thousands of antibody tests that will give people the information that we need.
Very promising news. Tiga Besson asks next, how can we avoid COVID-19 when we return to work?
Well, we need to be really vigilant because we know that the virus will still be circulating. Just because most of us have been in lockdown doesn't mean to say the virus has gone away. Hundreds of thousands of people have been at work, and they've had to have been at work. We needed doctors and nurses and delivery drivers and cleaners and porters and public transport workers, people driving trains and buses. We needed them all to stay at work, paramedics and police, hundreds of thousands of people. And of course, the virus is still out there circulating. So when we come out of lockdown, we will need to be careful about reducing our risk of transmission of the virus. And that means regularly washing our hands. It means keeping a social distance from other people, whether we're going back to work or just going to the shop. We will need to continue to do this for some time until such time that we have an effective vaccine that is safe. And, you know, for people who are in the high risk groups and the vulnerable groups, even more important to stay vigilant, to be careful and to stay at home as much as possible.
And the last question today has been sent in by Mary Rankin.
Hi, Dr. Hilary. I have a question for you. It's in relation to visiting a coronavirus test centre. Can you get coronavirus by visiting the test centre? And could you get coronavirus from the test itself? Thank you.
Well, Mary, the answer is you can't get it from a test kit. The test kit is sterile. It's been sealed. It's completely 100% safe. And it'll be delivered by a trained person. The swab is taken of the nose and the throat. And that person will be protected, wearing a mask and keeping a reasonable distance from you. So the risk of having the test is minimal, absolutely minimal. And the second part of her question, Dan, was...
She also wanted to know whether you could get it from visiting a test centre. Yeah.
Wherever the test centre is, whether it's a test that's been sent to you at home, whether it's a mobile unit that is coming to your place of work, whether it is in a hospital, or whether it is in a care home or a test sent to your home, it is a completely safe test.
Great news. If you have a question for Dr. Hilary, you can use the hashtag AskDrHilary on social media. Or if you want to go to our website, you can do that too, thesun.co.uk/Dr. Hilary or talkradio.co.uk. And Hilary will be here answering more of your questions tomorrow. So Hilary, we'll speak to you then.
All right, Dan, look forward to it.